each day that I would work, something would come out and it would not be like the previous day.
Everything changed 8 years ago when at age 74, Morton was diagnosed with Parkinson's disease.
With Parkinson's, you live in bits and pieces, it seems.
Gordon Rogoff and Morton Lichter did everything the right way. They planned for retirement, saved their money, and lived well but within their means. It didn't take long before the bills started piling up. Medical costs, long-term care, prescriptions. The expenses began stealing the money they had saved for their later years.
Parkinson's, as I think we've had a good occasion to discover, is a particularly cruel disease, a progressive disease, so things get worse. Morton's increasingly in need of care and doesn't have the income that will help him. Where do we turn for long-term care? He may be eligible for Medicaid, but how do you go about that?
At age 84, Gordon is well-read, worldly, intelligent. He is a professor at an Ivy League university. You would think he could figure out Medicaid. But he admits the system outsmarted him.
No ordinary citizen can negotiate, find his way through the paperwork and the complications of these labyrinthine systems.
After spending tens of thousands of dollars on hospitalizations and other healthcare costs, money pulled from their retirement funds, a nonprofit organization helping LGBT seniors told them about Medicaid Advisory Group, which helps people navigate through the system.
They're kind of your watchdog, your personal arbitrator, really, and you couldn't do it without them. I'm convinced. There's no way. You think my education has led me to this? Not at all. I'm not educated to cope with private and public bureaucracies. We all know what it's like.
Once someone goes into a healthcare system, it's a new world, it's a new language. We're advocates, but we are kind of like the air traffic controllers of healthcare, where we're navigating and we're guiding and we're making sure that all of our clients are going to maximize their Medicare and they're going to maximize their Medicaid, and we preserve their income.
I worked over 40 years and contributed to my insurance and disability, and it built up over $2,000 a month, and that was too much to get Medicaid.
Arthur and Maritza Deutsch worked their entire adult lives and paid into the system they thought was going to be their safety net. Arthur had to stop working and go on disability shortly before he was properly diagnosed at age 58 with PLS, a degenerative motor neuron disease similar to ALS. Since then, he has been hospitalized 3 times, in and out of rehab facilities 4 times so far.
Through the hospital, they helped us apply through Medicaid, but they denied us because of his income. We were stranded financially. We had no money left and we couldn't pay our bills.
The hospitalizations and constant level of medical care his condition requires had put the Deutsches into debt tens of thousands of dollars. With just a meager disability income barely covering day-to-day expenses, Medicaid denied them coverage 3 times. The frustration of dealing with the seemingly broken system started to take its toll.
We were very discouraged and we felt like, wow, what are we going to do now? You know, we really cannot pay the 20% from the Medicare. We have to find a way. So I appealed it and they denied it again.
That's when a different nonprofit organization told Maritza and Arthur about Medicaid Advisory Group.
Sure, no problem. So, can I get your name?
When I first called and explained to Gina that we had been denied on numerous occasions, I had appealed the process a few times, she assured me and guaranteed me that she could help us get the Medicaid, and she did.
We are a consulting firm. We assist our clients in becoming eligible for Medicaid to cover home care, assisted living, and nursing home expenses.
Medicaid Advisory Group not only helped with their bills, but it also advocated on their behalf to get a therapist and home care aides to come to their apartment to help with Arthur's rehabilitation. Medicaid Advisory Group also got additional financial assistance that helped them pay for Arthur's medication, which by this time the cost was skyrocketing. Because of their dire financial situation, Medicaid Advisory Group worked on their case pro bono.
There's so much resources that our clients have that are exempt from Medicaid, and no one really knows, and they go into these facilities and the nursing homes are telling them to exhaust all of these funds, and they don't have to, and this is where we come in.
Like with Morton and Gordon, the Deutsches and so many others are told to pay for their long-term health care expenses with their retirement funds, when they didn't have to exhaust that legally protected resource.
As my children brought a little money to get me to my next check.
Medicaid Advisory Group helps clients preserve the retirement funds they have worked so hard to build through a life of labor.
We get our clients up and running on Medicaid. Once we get the Medicaid approval, there's actually a conflict-free interest interview from a state official who comes in and sits with a client for 3 hours, and there's a nurse doing an assessment for 3 hours, and our social worker sits in that assessment.
Medicaid Advisory Group has nearly 25 years of experience helping families and seniors navigate the complex and cumbersome government system. The ins and outs of Medicaid eligibility can be confusing. Over 65 million Americans are on Medicaid, yet most of these people don't know what is covered, what is exempt, how to respond after Medicaid says no, and even how to navigate for better health care. But it's not just about paying bills. Maritza says she noticed a faster recovery with Arthur after Medicaid Advisory Group stepped in.
Medically and physically, mentally, it was affecting him knowing that we couldn't meet our goals in terms of, our financial situation. Now we have a state of mind that's more relaxing and stress-free. He's concentrating on getting better. He doesn't worry about the financial situation and where we're going to get the money from to get the medication.
For Gordon and Morton, the level of round-the-clock care Medicare Advisory Group has been able to arrange is a godsend.
Prior to the discovery of the Medicaid Advisory, I was, for at least 6 months, not getting a full night's sleep ever.
Morton is now spending more time on his art, something he says he will show at his next art exhibit.
I might start with a color, and that might lead to the next color, and somehow it takes on a different shape.